Sure. Candida auris is a type of yeast that is different from other species of Candida because it's often resistant to multiple antifungal medications. It can also cause serious infections, but it can also colonize or live on the skin without causing infections. And for that reason, it spreads easily in healthcare settings. So Candida auris acts very similar to some other resistant bacteria like Acinetobacter. And similar to Acinetobacter, it can colonize the skin and shed from the skin into the environment where it can persist on surfaces for a very long time.
Candida auris is an emerging fungus considered an urgent antimicrobial resistance (AR) threat by the CDC. It was first identified in 2009 in Japan, but since then, it has been reported in several countries around the world, including the United States, the United Kingdom, India, and South Africa. In March 2023, the CDC reported that C. auris spread at an alarming rate in U.S. healthcare facilities in 2020 to 2021. Equally concerning was a tripling in 2021 of the number of cases that were resistant to echinocandins, the antifungal medicine most recommended for treatment of C. auris infections. This resistant fungus can spread easily in healthcare settings, where it can infect vulnerable patients with weakened immune systems. In the United States, most cases of C. auris result from local spread within and among healthcare facilities in the same city or state. However, healthcare facilities should be on the lookout for new introductions of C. auris from patients who received healthcare elsewhere in the United States or abroad in areas with C. auris transmission. A fungal superbug called Candida auris is spreading rapidly through hospitals and nursing homes in the U.S. The first case was identified in 2016. Since then, it has spread to half the country's 50 states, and, according to a new report, infections tripled between 2019 and 2021. This is hugely concerning because Candida auris is resistant to many drugs, making this fungal infection one of the hardest to treat. Candida auris is a yeast-type fungus that is the first to have multiple international health alerts associated with it. It has been found in over 30 countries, including the UK, since it was first identified in Japan in 2009. It is related to other types of yeast that can cause infections, like Candida albicans, which causes thrush. However, Candida auris is very different to these other fungi and in some ways, highly unusual. First, it can grow or colonize human skin. Unlike many other Candida species that like to grow in our guts as part of the microbiome, Candida auris does not grow in this environment and seems to prefer the skin. This means that people who are colonized with Candida auris can shed lots of yeast from their skin, and this contaminates bedclothes and surfaces with the fungus. This can lead to outbreaks. It is unusual for a fungal infection to spread from person to person, but that seems to be how Candida auris infections spread. Outbreaks can happen with this fungus, especially in intensive care units, ICU, and nursing homes where people are at a higher risk for getting fungal infections generally. The fungus can live on surfaces for several weeks, and getting rid of it can be difficult. Enhanced cleaning and hand washing is needed to try and limit the spread of the fungus and exposure to patients who get ill from it. Most people who are colonized with Candida auris will not get ill from it, or even know it is there. It causes infections when it gets into surgical wounds or the blood from an intravenous line. Once it gets into the body, it can infect organs and the blood, causing a very serious and potentially fatal disease. So guys, hopefully you have liked this informative video, and if you liked this video, subscribe our channel. And don't forget to press the bell icon for latest updates.